Hi, my name is Delilah Lopez. In today's video, we'll be going over an analysis of a lunge movement. In this video, we'll be going over a description of a lunge. We'll also be going over joint mechanics and torque, its muscle function and activation. We'll be going over active or passive insufficiency. We'll be going over stretching, shortening cycle, and lastly, we'll cover injury risk and technique. So without further ado, let's go ahead and get started. So during a lunge movement, the knee, the hip, and the ankle joints are involved in a multi-joint movement. Um, the planes of motion that is also involved with the lunge movement is that it occurs in a sagittal plane. So that is a forward and backward movement. The lunge can be done forward or it can be done backwards. Okay, now going over joint mechanics and torque. So, where external torque is at its greatest is going to be at the bottom of the lunge. This is where we'll see maximum knee and hip flexion. Joint position changes during torque demands. Um, During a lunge by shifting the center of gravity relative to the knee and the hip. So, for example, having an upright torso during a lunge, we'll see a lot of knee torque and we'll also see a lot of hip torque. Now, lastly, for joint mechanics and torque, the joints that experience the highest mechanical stress during a lunge are going to be the knee joints or the patellofemoral joint, from both the front leg and the rear leg. Um, the stress is going to be at its highest at the bottom of the lunge movement, as we discussed, but this is because of maximum compression. So, moving on to muscle function and activation. So, the prime movers during a lunge movement are going to be the gluteus maximus along with the quadriceps. The synergists that assist in the movement include of the hamstrings, the adductor mangus, and the calves. And the stabilizers that are essential for balance and posture include core, abdominis, cerviobliques, and your hip abductors. Next, moving on to how joint position influences muscle activation. So, a joint position significantly alters muscle activation during a lunge by shifting its tension between the gluteus and hamstrings and the quadriceps. So, having a forward leaning trunk increases gluteus maximus and bicep femoris activation. And while having an upright posture emphasizes on the quadriceps. So the forward leaning leg generally experiences higher activation than the back leg. Next, moving on to active or passive insufficiency. So, one muscle that experiences passive insufficiency during a lunge movement is going to be the hamstrings. When the back leg is being kept straight, and the knee is being forced into slight extension or for it to stay neutral, the hamstrings are stretched over both the hip and the knee, which limits the range of motion. So, next, moving on to the stretching shortening cycle. During a lunge, the stretching shortening cycle acts as a spring like mechanism that stores energy during the descent and releases its power to push back to the starting position. So it transforms the movement from being a basic strength exercise into a high output power maneuver. Let's go ahead and go over injury risk and technique. So, one high risk joint position that can occur during a lunge movement is a knee valgus. And this occurs when the front knee collapses inward toward the midline. So the misalignment places an excessive stress on the knee joint and ligaments, increasing the risk for injury. Reason for this injury risk is due to high concentrated stress that is being put on the knee and the hip joints. It's both caused by a combination of forward knee displacement, poor balance control that leads to high torque and compression. One way that we can do a modification to reduce risk of knee valgus is to do a backward lunge. So, stepping backwards can help keep the front knee aligned over the ankle rather than allowing it to fall forward past your toes or your knee cave inward, which can reduce stress on the knee joint.